Hello and welcome. Today we're diving into a less commonly discussed but important condition of the urinary system, urethral diverticulum. We'll explore what it is, why it happens, how it's diagnosed, and what can be done about it. So let's get started. So, what exactly causes a urethral diverticulum? Often, it's related to recurrent infections in the small glands surrounding the urethra. These infections can lead to gland obstruction, abscess formation, and eventually rupture into the urethral lumen. This creates a small outpouching, or diverticulum. Trauma during childbirth or prior urethral surgeries can also contribute to its development. In some rare cases, they can even be congenital, meaning present at birth, though these are exceedingly uncommon. It's important to remember that the precise cause isn't always clear, and it's often a combination of factors at play. Now let's understand how urethral diverticulum actually affects the body. The diverticulum itself is a pouch-like structure that protrudes from the urethra. This pouch can collect urine, leading to recurrent infections as the trapped urine becomes a breeding ground for bacteria. This can then cause inflammation, pain, and other uncomfortable symptoms. In some cases, the diverticulum can become quite large, putting pressure on surrounding structures like the bladder or vagina, leading to further complications. Imagine it like a small pocket that collects fluid and debris, causing irritation and potentially disrupting the normal flow of urine. While precise numbers are difficult to obtain, urethral diverticulum is considered relatively rare, particularly in men. It is more frequently seen in women, with estimates suggesting it may affect between 1 to 6% of women. However, it's likely underdiagnosed, as many individuals may experience mild symptoms or be misdiagnosed with other conditions. Therefore, it's essential to consider this possibility, particularly when evaluating women with persistent urinary problems. Awareness of the condition is key to ensuring proper diagnosis and management. The signs and symptoms of urethral diverticulum can vary widely from person to person. Some individuals may experience no symptoms at all, while others may suffer from a range of bothersome issues. Common symptoms include post-void dribbling, meaning urine leaking after you've finished urinating, dysuria, or painful urination, frequency and urgency, feeling the need to urinate often and urgently, recurrent urinary tract infections, and pain during intercourse. In some cases, a tender mass may be felt in the anterior vaginal wall. It's important to note that these symptoms can also be indicative of other conditions, which is why accurate diagnosis is so crucial. Diagnosing urethral diverticulum typically involves a combination of a thorough medical history, a physical examination, and imaging studies. A pelvic exam may reveal a tender mass. Imaging techniques such as MRI, voiding cystoarthrogram, and ultrasound are often used to visualize the diverticulum and assess its size and location. Urethroscopy, where a small camera is inserted into the urethra, can also be used for direct visualization. The choice of diagnostic tests will depend on the individual's symptoms and the physician's clinical judgment. While not all urethral diverticula require classification, they can sometimes be categorized based on their location or size. For example, they can be described as anterior, lateral, or posterior, depending on their position relative to the urethra. They can also be classified based on their size as small, medium, or large. However, the most critical factor in determining management is usually the presence and severity of symptoms, rather than a specific classification. The treatment of urethral diverticulum depends on the severity of symptoms and the size of the diverticulum. A symptomatic diverticulum may not require any treatment at all, but regular monitoring is advisable. For symptomatic diverticula, treatment options include antibiotics for infections, and surgical excision of the diverticulum, known as diverticulectomy, is often the definitive treatment. Other surgical options include marsupialization, where the diverticulum is opened and stitched to the surrounding tissue, and urethral reconstruction. The choice of surgical approach will depend on the size and location of the diverticulum, as well as the surgeon's experience. Unfortunately, there aren't specific preventative measures to completely eliminate the risk of urethral diverticulum. However, reducing the risk of recurrent urinary tract infections through proper hygiene and adequate hydration can be beneficial. Prompt treatment of urethral infections can also potentially prevent the formation of a diverticulum. In cases where childbirth trauma is a contributing factor, careful obstetrical management may reduce the risk. The prognosis for urethral diverticulum is generally good with appropriate treatment. Surgical excision is usually successful in relieving symptoms, although there is a risk of complications, such as urethral stricture or fistula formation. Ongoing research is focused on improving surgical techniques to minimize these risks and optimize long-term outcomes. Newer imaging modalities and minimally invasive surgical approaches are also being explored to further enhance the diagnosis and treatment of this condition. Remember to consult your healthcare provider for accurate diagnosis and treatment.